volume and capacities. Determination of lung volume is used to assess the efficacy of respiratory system, functioning of respiratory system, and diagnosis of respiratory disease. So this is used for the assessment efficacy of respiratory system and diagnosis. Most of these volume can be measured using spirometry. This is the old version spirometer, Bell chymograph, and new version spirometry measures how fast and how much air you breathe out. Tidal volume. It is the volume of air inspired or expired each breath during normal quiet breathing. It is about 500 ml. It is very important lecture, so you should know how many types of volume, lung volume, and how many types of vital capacity. So you should know, and in examination point of view, you should remember these volumes and capacities. This is the tidal volume you show in the whole diagram. It is equal to 500 ml. This is the inspiratory reserve volume, maximal volume of air which can be inspired after a normal inspiration. Inspiratory means inhale. We take inspiration, so we would inspiratory. So it is about 300,000 ml. Inspiratory reserve volume. Inspiratory reserve volume. Expiratory reserve. We breathe out. It is maximal about 1100 milliliter. This diagram shows tidal volume, inspiratory reserve volume, expiratory reserve volume, residual volume. It is the volume of air remaining in the lungs after maximal expiration. It is the volume of air remaining in the lungs. It is about 1200 ml. It is residual volume. All the volume can be measured by spirometry except residual volume. Okay. Lung volume. This is the diagram. Lung volume, residual volume, expired reserve volume, tidal volume, inspiratory reserve volume. Inspiratory reserve volume, tidal volume, expired. You should remember and know how many types of lung volume. Lung capacity. When more capacity measurement of two volume are more added together. Capacity means pulmonary capacity. When more two volume or more volume added is known as pulmonary capacity. It is again divided into 4 or 5 types. Inspiratory capacity. It is the maximum volume of air that can be inspired from the resting expiratory volume. So, inspiratory capacity, tidal volume plus inspiratory reserve volume. Inspiratory capacity 500 plus 300, 3000. So, total amount inspiratory capacity is 3500 ml. You should clearly see in the diagram. This is the diagram shows spirographic record for male. This is the diagram. Inspiratory capacity, functional residual capacity, inspired reserve volume, tidal volume, all the volume mentioned in this diagram. So in the examination point of view, you should know all the diagrams which I tell you now. So in the examination point of view, you should click the point where the tidal volume, expired reserve volume, inspired reserve volume, and their normal amount. For example, tidal volume 500 ml, inspired reserve 3100 ml, expired reserve volume 1200 ml, residual volume 1200 ml. Functional residual capacity is the volume of air which remains in the lungs at the resting expiry level after normal expiration. After normal expiration, volume remain in the lung is known as functional residual capacity. Functional residual volume plus expiratory reserve volume. You know residual volume 1200 and expiratory reserve volume 1100. So total amount is Functional residual capacity is 2300 ml. This diagram shows again with same picture is inspired reservoir volume, 24 functional residual capacity. Vital capacity is the maximum volume of air that can be inhaled or exhaled from lung during respiratory cycle. Vital capacity and vital tidal volume is very important volume and capacity. Vital capacity means inspired the volume, to tidal volume, expired. I already told you vital capacity what is made more or two or more added volume or get together, that this is known as vital capacity. So this is about 4600 ml. Total lung capacity, it is the volume of air contained in the lung at the end of maximal inspiration. This is 58 ml. 5800 ml. This diagram shows total lung capacity 58 means 6000 ml. Lung volume, total lung capacity, vital capacity. This diagram shows total lung capacity, residual volume, functional residual capacity, inspired capacity, tidal volume. This diagram shows the lung volume. Lung volume and capacity are decreased in the lay down position, women than in men by about 20 to 5%. Small height person, old age, increase in larger and athletic person. All lung volume and capacity are measured directly by SPIR, except you should know which volume cannot be measured by spirometry: functional residual capacity, total lung capacity, and residual volume, because the air in the residual volume of the lungs cannot be expired into the spirometry, and this volume constitutes part of functional residual capacity and total lung capacity. So these volumes cannot be measured by spirometry. Which volume? Functional residual capacity, total lung capacity, and a residual volume. Lung volume measured by spirometry. This diagram shows values obtained by simple spirometry for the other additional measurement any state. So this is the lung volume measured by spirometry. Spirometer. Factor affecting race, weight, height, sex, age. Person predicted values, observed values, oblique predicted values 100%. Determination of residual volume and functional residual capacity, they are measured indirect using helium dilution method. The functional residual capacity and residual volume, which cannot be measured by spirometry, so this can be measured by the helium dilution method. So the clinical significance, functional gas action with blood in between the breath. In between breath, the large volume of functional prevent marked rise in alveolar pressure. Normally, the residual volume should be less than 30% of total lung capacity. It exceeds that level in some pathological condition, example bronchial asthma, or this is the bronchial asthma in which the pathological condition, so total lung capacity exceeds. Minute respiratory volume, it is the total amount of air that moves into the respiratory passages each minute, inspired or expired. It equals tidal volume and expiry rate. For example, tidal volume is 500 ml and our breath is 12 breaths per minute. So this is multiplied, so 6000 centimeter per minute, or 6 liter per minute. So this diagram shows minute ventilation Ventilation and multiply breathing frequency 512, so 6 liter per minute. Maximum voluntary ventilation. So maximum volume that can be breathed per minute using the fastest rate and deepest respiratory effects. You should see in this diagram. Is the fastest and rapid effect. The subject breathes as fast and deep as possible for 15 seconds only to avoid fatigue or respiratory muscle, to avoid wash out of carbon dioxide. Normally minute maximal voluntary ventilation 80 to 160, 60 to 120 ml, average 100 ml per minute. It is better index for respiratory efficacy and physical fitness. Breathing reserve. Breathing reserve minute by breathing reserve maximum voluntary ventilation and maximum reserve volume. 100 minus 6 is 94 liters per minute. It is good test for functional reserve of respiratory system and higher in breathing reserve the better the state of physical fitness. Factor affecting the vital capacity. I already told you when two or more added more volume added, so known as vital capacity. Movement of diaphragm, strength of respiratory muscle, thoracic wall expansibility. When our thoracic wall expands, so that affect the vital capacity. Resistant to airflow, lung elasticity, restrictive lung disease. Vital based on age and gender. So in female 1000 to 2000 and male is more prone to female. Timed vital capacity, it is the volume of air expired at the end of the first second or third second when measuring vital capacity. It is also forced expiry volume. Timed vital capacity, importance of time. The time vital capacity is a useful test to differentiate between obstructive lung disease, for example chronic obstructive pulmonary disease as emphysema and chronic bronchitis, and restrictive lung disease as interstitial lung fibrosis. So, in obstructive lung disease, the airways resistance 80% while the restrictive 90%. Spirometry interpretation obstructive versus obstructive disorders and restrictive disorders. This diagram volume normal so FEV1 and F force functional force vital capacity and force expiry volume 1. So this diagram and this picture, when you take the volume of the patient, lung volume and capacity, this picture recorded in the spirometry, and we should diagnose the patient condition and respiratory system, either it is normal or maybe asthmatic any disease. So this picture shows that dead space, very important. It is volume of air which does not undergo gas exchange with pulmonary capillaries. So dead space, we ask from you what is dead space, types of dead space. It is a volume of air which does not undergoes gas exchange with pulmonary capillaries. Anatomical dead space, alveolar dead space, physiological dead space. Dead space ventilation. Include ventilation of both anatomical dead space, alveolar. So alveolar dead space plus anatomical dead space is equal to physiological dead space. This is the formula. Alveolar and anatomic dead space is equal to physiological dead space. Maybe this question maybe in BCQ, maybe we ask from you what is dead space and what is the formula or what is the dead space ventilation.